Does abortion prevent you from getting pregnant? So I'm going to answer this question. If you've had abortion before and you're finding it difficult to get pregnant, please watch this video. If you do, because you've done abortion, you're scared of doing abortion, you're scared that you may not get pregnant in the future, please watch this video as well and share it so that others will learn. Okay, now basically there are two ways abortion can take place, right? There's the one where it can be done surgically, and there's the one where it can be done medically. Now, most people probably have done abortion before, and they got pregnant, of course. So you can see that you can get pregnant when you have an abortion. You can get pregnant again. So this is probably because nothing went wrong in the previous abortion that they have. Now there is what is called criminal abortion. Criminal abortion is when you had an abortion, you removed a viable pregnancy, nothing is wrong with the baby, with the mother, nothing is wrong with the baby, and you decide to remove that pregnancy. This is called criminal abortion, and it is anybody in my country seen doing this is penalized. Okay, however, there is another kind of abortion where probably you're about to give birth, you're pregnant, probably you had a miscarriage, the baby aborted, something happened, you don't know what happened, but it's not like you went to remove the baby by yourself, either medically or surgically, right? Or is an abortion another kind of abortion where it just happens not it just happened, you were some months, 6 months, 7 months, and they find out that the mother is at risk of having health challenges. Probably the mother will die or something, and of course the doctor may now decide to do the surgical type of abortion, which is called D&C. Okay, which this particular one has to be done by a good medical doctor. Okay, now the two types of abortion that I'm talking about is D&C and D&C, which is a surgical kind of abortion, and medical kind of abortion where the lady takes pills and then has a spontaneous, the baby goes out. So having known these two types, now if this any of this type is done without a proper medical personnel, you see why is you people asking me to prescribe drugs for you? I don't prescribe. If they're not done by a good medical doctor, okay, which for a doctor to do this, there should be a reason in my country. These are the things that will happen if D&C is being done by a doctor that is not qualified. These are the things that will cause you to have that will make it difficult for you to get pregnant in the nearest future. Please don't forget to share this video. Number one, you may be at risk of having infertility. You may find it difficult to get pregnant in the nearest future if, number one, you had sepsis, that's infection. You may be have an increased risk. You may have what is called return product, where you see that you had this abortion 2 weeks ago and you are still bleeding. The bleeding is still coming small. It means sometimes it may mean that the part of the fetus may still be inside you, the part of the baby may still be inside you, and gradually, because of the return product, you may have infection. From normal infection, you may have systemic infection, and this is a serious infection. The next thing that can happen is increased risk of pelvic inflammatory disease, PID. If you have PID, how to treat PID, please locate the video here on my YouTube channel. I'm going to put it on the description box, the link on the description box. You may have PID, which is rampant right now. Almost a lot of women have PID. You may have some other kind of infection. You may even have sexually transmitted infection. If the equipment used, you don't even know how, if it is sterilized or it was just washed. There are ways we sterilize equipment. So most of it's not about washing. We don't wash equipment. So most of these hospitals that do this quick D&C for you, they will just wash the equipment and use it. It's not sterilized. Some equipment are meant to be cooked. So HIV, probably they use it on somebody that has HIV, you will not get it. But if it is washed, a chance that you get it is high. Okay, so you may have infection, you may have high chances of getting infection. The next thing is you may have what is called incompetent service, where your service is open or partially open, where this thing can now make, because your service is supposed to be closed, it makes when a baby enters there, miscarriage happens. You see, so because of, especially people that have been doing D&C done by a quack. So incompetent service, where the lady is now pregnant and is always having miscarriages. The next thing that can cause, and this thing that can happen, is hormonal imbalance. Because of this, your hormone may be imbalanced and make you to find it difficult to get pregnant. Sometimes the hormones are high, sometimes the hormones are low. So there are a lot of risk that can come in with this. So I advise you, please, if there, I remember the next thing that can happen is scarring of your fallopian tube or blockage. There may be scarring because of the infection. If a scarring may occur, or there may be blockage or anything that can scar your uterus or anything, and baby may not be able, fertilization may not occur. Please, anything that will make you do abortion, please avoid it, because there are so many risks. Okay, except is not a criminal abortion, because by now you should have known what criminal abortion is and what a non-criminal therapeutic abortion is. Okay, so having known about this, my name is Nosmais. I'm a nephrology nurse. If you're new to this channel, please make sure you follow us, subscribe. Let me know if you have more questions, put it in the comment section, or you can click on the link on my bio here to book a consultation with me. Have a nice day.